It usually goes like this. You were exposed to COVID by a friend, coworker, or family member, and you go home, you take out your handy at home COVID test, and perfect, you're negative. But are you really negative? Dr. Peter Chin Hong, an infectious disease expert and a professor at UC San Francisco, says maybe not, and here's why.
So if the test is positive, I think you're good to go, meaning that it is a true test result. But if the test is negative, it can mean two things. The first is that you're truly negative, but it may also be that you're positive, but there's a delay in the test telling you you're positive.
He says that has to do with virus and human factors, as well as limitations with the at home rapid tests. And false negative results often happen with people who are vaccinated and boosted.
The amount of virus to sound the alarm is so small because your immune system is active. It's not enough to turn the home test positive. So that's why you have to wait a little bit longer or repeat the test.
And that is what the FDA recommends. If you've been exposed and are with or without symptoms and test negative, wait 48 hours and test again for at least 3 tests. The FDA says the rapid tests will detect most infections, but if you keep coming up negative and suspect an infection, they recommend calling your doctor and getting a lab or PCR test. That's considered the gold standard. Chin Hong says now that home tests are more common, it's important that those who use them know their limitations.
Because you may be out and about, uh, potentially transmitting it to others if you're only doing one test, it's negative, um, and you had a real exposure or you have symptoms. Don't just stop with that one negative home test.
Because he says your test results can have serious health implications for those around you.
Your knowledge of the true test result is really crucial if you're living with immune compromised individuals or people who are not vaccinated, because it may have more serious consequences on them.
Kitty Alvarado, KPBS News.